Diving into the oral microbiome, yes, your mouth, and how it might be affecting your fertility, even if you don't have gingivitis. We're going to explore how the oral bacteria can influence both egg health and sperm quality, and even your chances with IVF. Plus, we're going to share simple but powerful strategies like oil pulling, tongue scraping, which toothpaste to avoid. This episode could change how you think about oral care and fertility. Let's go. I'm Sarah Clark, founder of FabFertile. For over a decade, my team and I have helped hundreds of couples improve their chances of pregnancy success, whether naturally or through IVF. We specialize in supporting those with low AMH, high FSH, diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss through functional lab testing and personalized fertility strategies. Today, we're digging into the oral microbiome and what this means for both egg and sperm quality. This episode is for you as if you've experienced canceled cycles, poor egg quality, or miscarriage, and no one's given you a clear explanation why. You're preparing for your next egg retrieval or transfer and want to make sure you're doing everything you can to optimize your chances of success. You have bleeding gums, recurring cavities, or gingivitis, and you're wondering what that has got to do with your egg quality and fertility. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who's on the fertility journey, please share this podcast with them. Okay, so let's get into the episode. We're talking all about oral health and pregnancy and egg quality. So, gingivitis and gum disease can increase inflammation and bacterial load and may trigger preterm labor or affect embryo implantation. Inflammation in the mouth sends cytokines through the bloodstream, and these can reach the uterus and disrupt reproductive balance. There's a 2010 meta-analysis showed that treating gum disease during pregnancy reduced preterm birth risk. So I think some of us know some of these pieces, maybe we don't, but we may know this for pregnancy, but it's equally as important to do this beforehand as you prepare for pregnancy. So oral inflammation is often silent, and many times people don't even know they have it. Maybe you're brushing your teeth and you get a little bit of blood on your toothbrush and you spit, you're like, and then you haven't gone to the dentist in a while. I'm pretty rigid about going to the dentist. I like going every 6 months for cleaning. Sometimes when I was having a more inflammatory diet, definitely had more buildup there, so to go more, but at least every 6 months. And we're going to talk about how this really impacts fertility. So the oral microbiome and male fertility. So that's why it's really important. It is not just about you making all these changes. You're changing your diet and swapping out the plastics and getting the reverse osmosis water filter and meditating. And your partner is, tell me what I got to do. He goes to the doctor, he's told his sperm is normal, and I don't know what I need to do. The people that we work with are open-minded. So it's really important to dig deeper, even though you're dealing with a low AMH or high FSH, diminished ovarian reserve, premature ovarian insufficiency, recurrent pregnancy loss. It's equally as important that your male partner works on his health. Or maybe his sperm, he's been told his count is a little bit low, his motility is a little bit low. There's always a reason. So looking at the oral microbiome could be something that we haven't even considered. So oral dysbiosis raises systemic inflammation in the body, which can impact the sperm count, your motility, your morphology, and even the DNA integrity. So pathogens P. gingivalis and F. nucleatum have been found in the semen, linking oral health directly to male reproductive health. And sperm quality improves after treating gum disease, suggesting this is a low risk, high impact intervention. Go get your teeth cleaned if you've got gingivitis or cavities, or we have avoided going to the dentist, because let's face it, the dentist there's a reason there's high suicide among dentists. It's not someone that people are like, wow, I want to go there and have someone pick at my teeth and maybe have a cavity and get a drill. This could be a reason why you're not getting pregnant. And so we need to bite the bullet. And there's a lot of interventions now where the dentist is not as scary as it used to be, and they can do a lot of things to help. The oral bacterial is a fertility disruptor, and looking at this for both men and women is key. The regular cleanings can reduce oral bacteria, lower inflammation that can impact your hormones and implantation. And you want to go at least every 6 months, or if you're trying to get pregnant, every 3 to 4 months. You want to use a soft bristle brush. You can consider ozone therapy or air polishing. You want to make sure you're not using fluoride in your toothpaste. You want to make sure you get an organic, non-toxic toothpaste. We do the gut testing, looking at your gut microbiome. And then we look at the male partner, looking at his semen, looking at his blood. And then because we see people swapping fluids, they can have similar gut microbiome. And then here we are, if we've got dysbiosis in our mouth, our oral microbiome, we're swallowing, this is gross, but we're swallowing all that all day long. And then that's going right into our digestive tract. The mouth is the start of the gut, it seeds the GI tract. And so oral pathogens contribute to gut dysbiosis, inflammation, and that intestinal permeability. And so poor oral health can be correlated with IBS, that catch-all symptom. You got diarrhea, you've got constipation. Maybe it's your oral health that's poor. Irritable bowel disease, Crohn's colitis, metabolic issues, all which impact fertility. And yeah, so you want to look at some strategies to actually be able to optimize this. So you can consider oil pulling, where you take the coconut oil, you swish it around, or sesame oil, you can swish it around your mouth for 5 to 15 minutes. Ideally, first thing in the morning, you can do it while you're in the shower. And then it helps to remove these pathogens such as the Streptococcus mutans, the P. gingivalis, which are linked to systemic inflammation. And so you want to make sure you swish that around. It can also help whiten your teeth. You do not want to spit that down the sink because then you're going to clog your drain. So spit it in the garbage. It's an ancient Ayurvedic treatment to lower your bacterial load, improve the oral gut microbiome balance, and it can be crucial to help with your hormone regulation and fertility. And then that coconut oil contains lauric acid, which is known for its antimicrobial and inflammatory properties, making it really gentle and effective for an oral detox. So it can improve your gum health, your breath, even your skin clarity, all of which points to an inflammatory burden. This is over, so we're not do this right away and expect immediate results, but it is a daily thing to add to your, while you're in the shower, while you're washing your face, just swish it around. I have done it for a period of time. I'm not doing it now, but as I'm talking about this, it's time to bring it back in. But I did do it for a period of time, did notice my teeth were whiter, and then just the mouth felt cleaner. This is the next one, tongue scraping. So the tongue is a major reservoir for oral bacteria, especially overnight when the salivary flow decreases and then the bacteria accumulate. So you're looking at scraping your tongue with a stainless steel or a copper scraper helps to remove this biofilm, which is then going to reduce the bacterial load, preventing bacteria in your mouth, which can infect your teeth and your gums. And so it supports obviously your breath, improve taste perception, and then maybe it may reduce the burden on the immune system. From a fertility perspective, anything you can do to lower the bacterial load, so lower systemic inflammation, that improves your hormones. And you want to avoid that alcohol-based mouthwash. They have ethanol, so alcohol that's going to aggressively kill the bacteria, both the bad bacteria and the good bacteria. So when we do our protocols, our gut protocols, if we're eliminating parasites or bacterial infections or fungal infections, sometimes we do need to use an anti-parasite or an antifungal, but we need to bear in mind that when we bring that in, and when you work with your doctor to do that, you bring that in, you're also wiping out all the good guys. So you need to work on all the repair after. So in this case, the mouthwash, we're just stripping the mouth. And then that can leave the oral microbiome imbalanced and vulnerable, like those antibiotics that we just talked about when you're throwing those in the gut. And then alcohol can also dry out the mouth, reducing the saliva production. And that saliva plays a critical role in maintaining a balanced pH in the mouth, which is going to control the pathogens. And so long-term use of the alcohol-based rinses may increase the risk of oral cancers, disrupt nitric oxide, which is the key for blood flow, including your reproductive organs. So you want to have an alcohol-free rinse, so consider xylitol or salt or herbal antimicrobials like clove or things like that. And then you've probably seen this all over TikTok and Instagram, mouth tape. So again, I've done this for a period of time. There was a period of time where my daughter in her teenage years, my husband and I would go to bed, we both put the mouth tape on, so we like kiss with the mouth tape. And then he also had the nose strip for the breathing and the mouth tape. And then someone was knocking at our door late at night. Where's your daughter? Blah, blah, blah. So he goes to the door, opens it up, and he looks like he's some sort of monster with the mouth tape and the strip. And no, she's not here, but mumbling it with the mouth tape. So breathing through the mouth, especially at night, leads to dry mouth. disrupts your oral pH, and bacteria will overgrow it, reduces the nitric oxide production, which plays a role in the vascular health, oxygen delivery, and then your reproductive health. And if you're a mouth breather, chronic mouth breathing can link to oral dysbiosis, gum disease and cavities, poor sleep, which can then impact your reproductive hormones like LH, FSH, and your melatonin. And so try out some mouth taping. If you're like, ooh, I've always breathed through my mouth, it is training. Obviously, if you have blocked sinuses, that's a whole other situation to be able to clear that out and clear out the nose passages using saline rinses. But it can help encourage the nasal breathing, support some moist and oxygen-rich oral environment, enhancing your sleep quality. So if you are snoring, consider this mouth tape. And then we got to start going down sleep studies and things like that. But first strategy would be to look at some mouth tape. And so if you've got a dry mouth, so saliva is more than just moisture, it contains enzymes, immune markers, and helps maintain the oral homeostasis. And so it could be caused by stress, a dry mouth, medication, dehydration. A lot of us just aren't drinking enough, mouth breathing. And then that's when the pathogenic bacteria comes in. And so then it's give you a higher risk for cavities, gum disease, that pH imbalance, systemic inflammation, and then that dysregulation in the oral and the gut microbiome. So it's all connected. It's not just one little silo that when you go to the dermatologist for the skin issue, the gastroenterologist for your gut issue, the rheumatologist for your joint pain, all these different specialists, but we need to look at the body as a whole. So you want to have more hydration, more water. Usually it's 50 to 75% of your body weight in ounces in water per day. So if you're 130 pounds, it's 60 ounces of water or 65 ounces of water. You can consider some humidifiers to support that, and then also electrolyte balance too, to encourage hydration. So we talked a little bit about the toothpaste. You want to consider a hydroxyapatite is a toothpaste to consider. It's a naturally occurring mineral in the teeth and bones, and it plays a key role in remineralizing your enamel, protecting against cavities. You don't want the fluoride. Fluoride's been linked to potential disruptions in the gut microbiome, and the hydroxyapatite is gentler. It does not disrupt the oral microbiome, rebuilds the enamel, and it can help reduce inflammation. I think many of us know this. Don't have toxic toothpaste. Like, just check it out on Think Dirty or the EWG.org and look at your toothpaste, and then once it's finished, switch it out for a non-toxic. So you don't want the sodium lauryl or the SLS, which is common in many toothpastes. It can cause irritation to the gums and the mucous membranes. You don't want triclosan, so it's an antibacterial agent. It can good at killing bacteria, but then it's going to impact the balance of the oral microbiome. So you don't want that one. And you don't want those alcohol-based mouthwashes are going to dry out the mouth. So there's some studies actually that came out. I'm going to link some of these studies at the end of this episode about periodontal disease and semen quality, also with periodontal disease and adverse pregnancy outcomes. So a number of different studies that have come out all about the oral microbiome. Brush your teeth. Make sure you don't use toxic toothpaste or alcohol mouthwash. Consider the connection between the oral microbiome and the gut microbiome. And if you've got gingivitis, if you've got bleeding gums, if you have a dry mouth, if you are snoring, if you have disrupted sleep, this is a key to dig deeper. Consider that mouth tape and try some oil pulling. And this could be a factor why the embryo is not making it, and looking at this for both you and your partner. So if you wanted to improve your chances of pregnancy success and get our team to have their eyes on your specific case, you can send a message to hello@fabfertile.ca, subject line fertile, and we can give options to help. Thanks for listening. Take care.